Hi, I'm Rachel Wall, founder of InspiredHygiene.com, and I want to talk with you just for a moment about the reevaluation visit after non-surgical periotherapy. So I had an interesting conversation with the hygienist recently, and she was nervous because some of her patients were starting to come back for a reevaluation. I said, well, what makes you nervous about that? She said, well, I'm afraid I won't know if it worked. She was nervous that she wouldn't know if the treatment that she had done had gotten the result that she desired. And so I continued asking her some questions, and what we discovered was that her expectation was that every one of those perio patients would need to go back to no bleeding and 1 to 3 millimeter pocket depths in order for the treatment to be a success. And so this was a real learning opportunity for us, and she had a huge sigh of relief when I explained the following things to her. So, couple things need to happen in order for you to see a specific result from your non-surgical therapy. One is tissue response. This is the most obvious and easy to measure point of evaluation. Okay, one. Okay, tissue response. And what we see with tissue response is we want to see a reduction in pocket depth, a reduction in bleeding. And notice I didn't just say bleeding on probing. This is generalized bleeding, right? Because you've always had those patients who you may do the probing and they may not bleed, but when you go on with an Explorer or Scalar, things just open up. So generalized reduction in bleeding and improvement of tissue tone and color, okay? So improvement of the appearance of the tissue, right? The other thing that is very hard to measure unless you do blood testing is what we call the systemic effect. Okay, and a couple journals were really interesting to me as I was doing research for this video. One is an article that was published in the Journal of Perio in 2009 that was a pilot study on looking at inflammatory markers and how they were affected by non-surgical therapy. And what they saw is there was a dramatic reduction between 21 and 40% in those patients that had non-surgical therapy, reduction in CRP levels and fibrinogen and in white blood cell counts. So they saw in this pilot study that there was a relationship between non-surgical periotherapy and reduction in those inflammatory markers. Another study, very interesting, also published in the Journal of Perio in 2010, looked at risk factors, periodontal disease, compared to the risk of what they call acute cardiac syndrome, which is an umbrella term that's used for any event that stops blood flow to the heart, for instance, a heart attack. Okay? And what they saw in this 3-year study is they saw that periodontal disease was absolutely a risk factor for these acute cardiac syndromes. So when you're doing non-surgical therapy, you have the tissue response, the very easily measured obvious result that you want to show specifically to your patient, and some of these systemic effects that may be harder to demonstrate, but may be happening all the same. So I thought this was a very interesting point that she brought up and a good quick tip. Please let me know if you'd like to have reference of either of these articles. We'll be happy to send it to you. You can just send an email to Rachel@InspiredHygiene.com and would love to hear your comments and feedback. Thank you so much.